And Dr. Kevin Kavanagh is a retired physician and also the founder of an organization called Health Watch USA. Good morning, Dr. K.
Good morning, Jack.
How are you this morning?
Doing very well, very well. Except I have to go to the dentist in about 2 hours, so that's a little downer. I don't like that, but otherwise doing well.
State's positivity rate now 3.18, down slightly. It's really kind of been hanging in limbo for a while, but I guess the good news is there are currently 318 COVID positive patients. 99 of those are in the ICU and 45 are on a ventilator, but I think that's the first time that the number has dropped below 100 since the outbreak, I think, or at least in a long while. So it's not all bad news, and the number of unique Kentuckians vaccinated, 1,723,624. And overall, this week we saw a 13.99% decrease in reported cases compared to the week before. So, a little bit of good news this morning. We'll take it anywhere we can get it, right?
Well, definitely. The vaccine works. As you know, many weeks ago, you asked me about the dire predictions from the CDC and if there would be a surge. And I said, well, I don't think so. If everybody gets this vaccine, we should be able to decrease these cases because the vaccine is also effective on the variants, as was illustrated by the outbreak in the Kentucky nursing home. So I really do want to encourage people to go out there and get the vaccine. I mean, that is our ticket home to getting out of this COVID nightmare. And so I really do think we've got the tools to get out of it. Let's utilize it.
On the bad news, it sounds like it's really rough on India right now.
Well, yes. And anybody who doesn't think COVID is serious, you should look at the news regarding India. If you don't trust the U.S. news, get online and read what's going on there from the Indian Times or their major media outlets, or talk to somebody on India on the internet. It is absolutely terrible. And that's what we could have been if we didn't start taking this seriously. And luckily, enough people followed public health advice. We have a lot of people getting vaccinated, and that's allowing us to avoid the fate of India. But this virus is serious, and we don't need to have it just smoldering in our nation for years and years because we have a large group of people not getting the vaccine.
And we see this morning that they're predicting that if things keep going the direction that they're going in, people may be once again allowed to tour Europe this year with a whole bunch of caveats, a bunch of restrictions, and if they open it at all, it's going to be with proof that you've been vaccinated, etc.
That's correct. I mean, vaccine passports are going to be here to stay. We may not use them in all areas of the United States, but certainly in Europe and other nations they are, because they're taking this virus extremely seriously, both from the aspect of deaths and also from morbidity, in other words, long hauler syndrome. So we really do need to get vaccinated. And if you are vaccinated, remember, you still can spread some of these variants. And so it is very much, I think, your responsibility to respect others when you're outdoors. Give them a wide berth. Don't just run by them or bicycle by them. You need to still wear a mask outdoors if you're going to be up close to people.
All right. Anything else you want to share with us this morning?
Well, I really think the main thing is just getting vaccinated, and you need 2 doses, and that is the key. Right now, 5 million people have missed their second dose. The second dose is imperative to give you enough immunity against these upper level tier variants. In other words, the E484K variants. So please get both doses and get vaccinated.
Dr. Kevin Kavanagh, always a pleasure, sir. Thank you.
Thank you, Jack.